Now we want to look over the different aspects of the Molina Marketplace plan on the Washington Health Plan Finder. Here's our disclaimer. This is an overview of your plan. For the actual specifics, they will send it to you in the mail. You can call Molina and they can give you the exact details of your plan. Next thing is to make sure that we are your broker of record. Click on Find a Broker and put in our agency name and last name and click Search, and that should find us. So you want to make sure we're your agent. We get paid a small commission built into the price. For the Molina plans, there are 3 plans on the Washington Health Plan Finder. So there's a huge difference between Molina Marketplace, which are the plans we're looking at, and Molina Medicaid or Apple Health. So you want to call your doctor's office and say, do you take Molina Marketplace through the Health Plan Finder, not Molina Medicaid or Apple Health? You want to say those words because it's very important that you're in the correct network. So as the core hospital network, in general, Swedish and Providence doctors take this plan, but not all Swedish doctors do. Most of them do. So as we've experienced, sometimes doctors can go in and out of any network any time of the year. So you just need to make sure that those are covered at this time. The other is UW Medical, Harborview, Northwest Hospital, Overlake in Bellevue, Valley Medical in Renton, Multicare in Auburn, Good Samaritan, and you can see the other ones as well. But you definitely want to go on to our video that looks up doctors and facilities and make sure that your facilities are covered from that perspective. The most popular plans are Molina plans for 2017 because they're the lowest cost plans. They actually have a very good network for the price. The silver plan is by far the most popular. So if you look down below, anything down below is covered before the deductible in general. So the silver $2,500 deductible plan is a very good one for those that take expensive prescription drugs or have ongoing medical issues. They just work quite effectively. If you're going to have a significant amount of more expenses, oftentimes the gold can be a better price. You just need to look at the extra price for the max out of pocket if you're going to hit that to see what the value is. But as a whole, the Molina plans are very strong. The one downside to Molina, they have a little bit smaller network of independent doctors and physicians. So if your doctor works at a larger facility like Overlake or UW, pick the plan. It works well. Just make sure they're in the network. If you go to a lot of different naturopathic doctors that are independent, a lot of them just take cash anyway. So you want to look at the cost-benefit analysis for 2017. Here's the states last year where Molina was located. So here's an aspect of the different plans. Here are the counties that Molina Marketplace are offered in. If your county is not on here, you can't choose the plan. So just want to give you an overview. Here are the different plans that are offered. Here's the bronze plan that's detailed out a little bit further than our last example. So take a look at this, pause it if you need to, and re-review it. We're just going to go through here. But in general, you want to choose a bronze plan if you have less medical expenses, because it has a $66.50 deductible, but you can go to the doctor as many times as you would like to. Here's the silver plan that most people were choosing in general this year, and the gold plan itself. If you have a cost savings reduction plan, if your income's below a certain level for the size of your family, you may qualify for one of these plans as well. We just want to show them to you. For 2017, the mail benefit for pharmacy has been improved with Molina Marketplace, and the formulary has been expanded slightly. So it is a very good plan, but not all plans cover prescriptions better than others. It just depends on your specific situation. You can look up doctors on our doctor video and our prescriptions on our prescription video. Oftentimes you will need a prior authorization, but it's because of your doctor's office, not because Molina requires it. So just want to make that clear. Here's how you can get your user ID set up, change your doctor, update your information, request an ID card. Here's an example of an ID card, which you can print a temporary one. Here's a list of all the doctors. You can look those up on our doctor lookup video. It gives you an overview. And we strongly recommend you to set up auto pay from a checking account. If you set up from a credit card and there's fraud or something gets canceled and resent to you and you're canceled due to non-payment of premium, you can't get coverage till January 1st, 2018. So we do recommend that, but there are several ways to make payments for your convenience. So if you have any other questions, please give us a call, but re-review this again if you have a Molina Marketplace plan.